So sore is basically an ulcer. So sore is something that's like a wound that's open. And it starts, it's almost like, you know, when you get hurt, like an abrasion on your knee or something like that. And when the scab is off, how you have like an open wound with redness, that's how a sore looks like, right? Sores always in your genital area or in your vaginal area do not have to be an STI, but they can be an STI. So I would like to divide sores into STIs and non-STIs, right? And if it's STIs, there are usually two types of sores that we see very commonly. And one of it is herpes. And the herpes sores are very painful, itchy, annoying. And they tend to come back again and again in the same spot. And if that's happening, you need to go and check, talk about herpes, see how you can prevent that from coming over and over again, because herpes is the cold sore that you were talking about. Cold sores are usually what we see here in the, in the mouth area, and it's caused by type 1 virus, right? But because of a lot of oral sex, apart from having type 2, which is the genital herpes, we also see type 1 in the genital area, which has become so common. And they tend to come back, like we would have seen like grandparents or so many friends or family members having these cold sores when they fall sick, usually when people have fever, you know, when they're traveling and stuff. Always they have an outbreak, and it's never been a big deal till it got transferred to the genital area. So for some, it's just the area that's made the difference now. So it's not really the cold sore. I mean, all of us have been dealing with cold sore for ages, but when you see cold sore in your genital area, then it becomes a whole genital herpes situation, and everybody's freaking out and panicking about it, which you really don't have to, because we're used to this kind of having a virus in our body and, you know, getting outbreaks for ages. The cold sore is something like that, and the chickenpox virus is also something like that. When we have chickenpox as a child, it goes back, sits in our nervous system, and it keeps coming back when your immunity is low. And so we've been dealing with this kind of virus for a very long time. So herpes virus is a painful sore down there. Sores that are not painful are a bit more concerning, because usually syphilis has sores down there that are not painful. But if you're having sores down there or something like a hair follicle infection or a pimple, don't freak out, guys, and don't start squeezing it, or don't start thinking, oh my God, she said painless means it's syphilis. It's not really hurting. Maybe I have. So it's not really like that. Syphilis is, I would say, depending on the area or who you're having sex with or how many partners you're having, syphilis is not very common, but it can be. But so if it's a painless sore and an STD, we're thinking about more syphilis. If it's painful, we're thinking more about herpes, right? And you can have sores down there which are not STIs, and they could vary from sores because of bacterial infection, like staphylococcal, streptococcal infection. They could be other viruses causing sores down there. Trauma, if you have, if, like a zipper, or if you hurt yourself there, or it was rough sex, or, anything, a bit of trauma can, have a, cut, and then that can really hurt, and that might feel like a sore. So there's so many other causes of having sores down there, which does not have to be STI. So the bottom line, I think, to this is, Rashi, if you're a sexually active individual and you're having symptoms down there and you're concerned, you need to get checked. It's as simple as that. And if you're not, or if you're having one partner for the last, 3 years, it's a stable relationship, and then let's say you shaved all your hair and you went for a laser or something like that, and then, you found after the laser treatment, you feel like it's burning and there's a bit of a sore, I don't think there's necessity to panic. Depending on your risks, you can definitely go and get it checked. It could be like a slighter, stronger wavelength of the laser, or it could be a small burn. It could be anything, like that. So considering what your risks are, always go and get tested. And sores, like I said, don't always have to be an STI. So don't freak out. Every time you see something down, don't freak out, because I know there's so many of us out there trying to talk about STIs and inform. So, but I don't want people to get like paranoid at all. I mean, look at the world population. It's 7 billion. Everybody's having sex. So it's really not such a big deal or a bad thing. But if you just have to be open about it. I'm doing it. If something is there, I'm going to get checked. It's as simple as that.